Hello everyone. Today we are going to discuss an important and exam oriented topic in physiotherapy, community based rehabilitation. It is not only a theory topic but a practical approach where physiotherapists work directly with people in the community. It focuses on improving function, independence, quality of life. This is very important topic for BPT, MPT, community health and public health students, and it is frequently asked in competitive exams. Let's start with definition of CBR. It is a strategy within community development for the rehabilitation, equalization of opportunities, poverty reduction, and social inclusion of people with disabilities. In simple words, it means providing rehabilitation services at the community level instead of hospitals. Next thing is important of CBR. Majority of people with disabilities live in rural and low resource areas, and hospital based rehabilitation is expensive and inaccessible. Shortage of rehabilitation professionals in villages. Social stigma and a lack of awareness prevent people from seeking treatment. Long term disability needs continuous care, not short hospital visits. So, CBR helps to bridge the gap between hospitals and the community. Next one is the objectives of CBR. The main objectives are to improve functional independence of person with disabilities, to involve family and community members in rehabilitation, to improve quality of life, to promote equal opportunities in education, employment and social life, to involve family and community members in rehabilitation. Next, we are going to see one very important one, principles of CBR. CBR works on certain important principles. First one is community participation, where community members take active roles. Second one is use of local resources. Locally available materials and minimally cost equipments are used. Third one is multidisciplinary approach. Physiotherapist, doctor, nurse, social worker, and NGO volunteers. Empowerment. Disabled persons make decisions about their own life. Last one is inclusion. Disabled people are included in society and not isolated. Next one is very important components of CBR. According to WHO, CBR has five major components. First one is health, physiotherapy and occupational therapy, prevention of secondary complication, early identification and intervention, assistive devices. Second one is education, inclusive education, special education support, lifelong learning. Third one is livelihood, skill development, vocational training, and self employment. Fourth one is social inclusion, marriage and family life, recreation, and sports. And last one is empowerment, self help growth, advocacy, leadership development. In exams, CBR matrix diagram is very important. Role of physiotherapist in CBR. Now let us discuss the role of a physiotherapist in CBR. First one is assessment. Home based functional assessment, muscle strength, range of motion, posture and gait assessment. Last one is environmental assessment. Second one is treatment. Home exercise programs, functional training, balance and gait training, chest physiotherapy in chronic conditions. Third one is prevention. Prevention of deformities, pressure sore prevention and contraction. Fourth one is assistive devices. Prescription of walkers, crutches, splints and training in use of aids. Last fifth one is family education. Teaching caregivers, positioning and transfers, ADL training. Sixth one is community awareness. Disability awareness programs, health education camps. What are the conditions we can apply CBR? First one is stroke, neuro based condition. We can use stroke in home based neuro rehabilitation, functional task training, and caregiver training. Second one is cerebral palsy, early intervention, parent education, and positioning of children. Third one is spinal cord injury, where we give bed mobility training, wheelchair skills, and prevent pressure sore. Fourth one is elderly population, fall prevention exercises, balance training, and home safety modification. Now let's see advantages of CBR. First one is cost effective. Second one is easily accessible. Third one, long term follow up possible. Fourth one is improve social participation. And the last one is family centered approach.